Good afternoon. I'm Mary Jane Jagodzinski. I'm Senior Vice President with Community HousingWorks, and I am really proud to be able to introduce our panelists today for cross-sector partnerships. I think in this time we will be able to provide some perspective of really almost a three-legged stool of how we can come together and have synergy for more than any one of us could do separately. We're using as a case study a project on the boards and soon to hit construction in National City. Our first panelist will be Mayor Sotelo-Solis. She needs no introduction, has been a strong advocate for sustainability and health and all wonderful things for her city. I will follow her and then bringing it to a close is Ana Melgoza of San Ysidro Health. And we please provide questions in the chat. But unless it's a burning question, we're actually going to hold it until we've done the three presentations. So with that, Mayor Solis.
All right, well, buenas tardes, everyone. I'm Alejandra Sotelo-Solis, the mayor for the city of National City. Very excited to share with you how we here in National City value very much so our partners from the health industry as well as the housing community, really to improve quality of life for not only our residents, but for the region. We see that everything truly is interconnected, from access to open space, to affordable housing, access to appropriate and so very much needed healthcare, especially right now during the pandemic. So we know that the partners that we have here today with Mary Jane and Ana, through Community HousingWorks and San Ysidro Health, we know that the projects that we will be sharing with you today really do make a difference. And as we talk about these partnerships, really highlight the project that is, we will be highlighting the Kimball Highland Master Plan and just kind of really talking about how we've been able to get to that point. One thing that I would like to share with you is National City's age-friendly efforts and why it is so significant to us here in National City. So with that, I will share my screen. I don't know if it's showing. Is it?
It is now, yes.
Okay, great. So National City has really focused on our efforts to become a more age-friendly community. And during my tenure of the last 3 years, we've been very purposeful. And the way with which we feel like we can do that is, and I've kind of dubbed it the twinkle to wrinkle effort, recognizing that whatever walk of life we are in, we really want to make sure that you have within 10 minutes of your community or your home, should I say, you have the ability to walk or roll in any direction. You should have access to a financial institution, open space, connection to mass transit, a healthcare community, access to recreation, a grocery store, all of these elements that really create good quality of life. And we say walk or roll because not only do we want the person who has all abilities, but we want the kid on the skateboard. We want the elder who has a walker, or heaven forbid you break your ankle, trying to wear the newest pair of shoes. It's all of those elements that you have protection and access to those amenities. And so we did have our community survey, what we learned, and those community conversations with our residents here in National City. So on November 20th, 2019, National City became officially the 40th enrolled community or city in the AARP network of age-friendly states and communities. And we were the 40 under 40, and we were just really excited to be part of that cohort. But it's also too recognizing that 40 communities throughout the state of California really took on this effort. And the county is one of those communities that also is part of the age-friendly network. So our goal at the city is to work with project partners like San Isidro Health and Community HousingWorks to create National City's first age-friendly action plan. And this document summarizes those feedback points from our community, as well as goals for implementation and policies and programs to strengthen the livability of the community for years to come. And those project partners, again, who help make it happen for the age-friendly designation, which is really kind of the foundation of how the conversation with our partners online really came about. And an age-friendly livable community is one that is well-designed. Age-friendly communities foster economic growth and make for happier, healthier residents of all ages. And you can see, so you can go for a walk. You can actually cross the street without worrying about getting hit. You can ride a bike. You can find the services you need to get a haircut, a dental service, get around without a car. What we find is that as you age, there may be more limitations as to the independence via vehicle. So we should be able to have mass transit. And here in National City, we proudly share that we got $1 million for our Frank, our free ride around National City, first EV, zero emission vehicle that will connect our parks. So we are truly taking our age-friendly policy and bringing it into action. In 2022, we're hoping to bring it to life here in our neighborhoods. Again, spending time outdoors, socialize, enjoy public spaces, go shopping, buy healthy food, and to make their city, town, or neighborhood a lifelong home. And as we talk about intergenerational families living in National City, I'm one of those people. And I'm third generation, my daughter's a fourth generation. So as we talk about aging in National City, I want to make sure that my great-great-grandchildren still have the opportunity to live here in National City. And as I age, I want to have a PACE center that I can go to, get taken care of. And who knows, maybe when I'm an empty nester, go into one of the studios available here in our community. So again, the 8 domains of livability in age-friendly community is transportation, communication and information, civic participation and employment, respect and social inclusion, health services and community supports, social participation, housing, and outdoor spaces. I'll just flip through these because I just shared with you what they were. But I'll back up. The community and health services, you know, at some point, every person of every age gets hurt, becomes ill, or simply needs help. While it's important that care is available nearby, it's essential that residents are able to access and afford the services that are required. And partnership with San Isidro Health has definitely been a godsend in that there are people who weren't sure if they could afford, you know, going to see a doctor, or did they have to pay for the COVID-19 tests, if we talk in present terms, and knowing that things were free, or if they enrolled because they were eligible into certain programs, it was all a possibility. I'm just going to click back to the housing one because I skipped over that. There we go. And most people want to remain in their own home and communities as they age. Doing so is possible if housing is designed or modified for aging in place or aging in community. And that community has diverse and affordable housing options for those varying life stages. Again, as you will see, it is all about every walk of life having the opportunity to live, and not just live, but thrive in National City. And it's just been a great opportunity. And I just wanted to share with you, it was, well, this year that we actually have our mid-year plan, and next year we are hoping to start implementing those action points. And one of them is through our Kimball Highland Master Plan. and sharing with you a little bit more about how the Age-Friendly Communities Initiative here, spearheaded by the City of National City, and really one of my, passion projects to my community, knowing that, again, we are all going to age. We are all going to need those amenities. Why not prepare our community so that we can continue to be part and thrive? So with that, I will kick it over to Miss Anna, right? You said Anna? Oh, no, to Mary Jane. To Mary Jane. I will kick it over to Mary Jane, who will share a little bit more about the Kimball Highland Master Plan Program, which is right down the road here from City Hall. I'm at 1243 National City Boulevard, and the master plan project is right on the corner of 12th and D, so down the road from City Hall. So with that, I'll kick it over to Mary Jane.
Thank you. Let's see, if you could stop share, I'll try to work the pedals here. And let me get this a little bigger, if I might. All right, thank you all. Yes, everyone needs a home and everyone needs great health care. So telling you just a minute about Community Housing Works. We are a San Diego headquartered and founded here, 34-year-old nonprofit. We work across the county, but we also work across the state. This is a map of where we have projects either on the ground or in construction. We do believe the little bullseye on the right is actually a graphic of kind of our mission. It starts with opportunity begins with a stable home, but then it's a stable community, an engaged community, and on top of that, resident services. We serve more than 10,000 people, families, seniors, disabled across the state. And again, we look at resident-centered communities we talked about resident services. We've always had a strong commitment to diversity, equity, and inclusion, and we're only highlighting it now to hopefully inspire others as well. But we're looking both along the whole path of what we do, not only for our residents and for us as a employer and a nonprofit, but how we look at construction and trying to make sure that all benefit with outreach from construction time. I'm bringing up a project that's was kind of in our portfolio, in our pedigree, project we did a number of years ago, in fact, with some county money in it. We're very proud of this in Poway. It's called Solara. It was the first near net zero development. And, and that's part of health too, really, the greenhouse gas reduction and what we can do in terms of promoting walkability, promoting renewable energy, et cetera. So when we finished this project in 2007, I'd say it changed the DNA of our organization, and we really became a green organization. And I know we are a designated county green organization. So a couple of things about some partnerships, and then we're going to get to the meat of this. We've actually worked with the City of National City on 2 other projects that I felt really changed my DNA and that were transformative. This first one is on the west side near the 22nd Street MTS trolley, and it's called Paradise Creek, and an aerial over here on the right shows it. This photo was taken before the new park, which just opened, was completed, a beautiful city park, which has an organic garden. And this combines apartments, again, with the park. It was a catalyst in this neighborhood for economic and environmental justice and for remediation. And the city was really very much part of this in how they planned for a specific plan. A lot of grassroots support among organizations. We are processing our LEED, which is a certification, neighborhood development. There are very few of those across the country, but it really looks at housing combined with neighborhood to make a difference in a neighborhood more than just a building. It's part of a Sandak Smart Zone as well. So as we go east to the city and near Kimball Park, we also worked with the city and acquired from them 2 towers for seniors, did major renovations, but we really look at that as preservation. These 2 towers, which will play into what we'll talk about with Kimball Highland, serve seniors, 303 apartments for seniors. It's a wonderful location. We also, in doing major renovation, created connection between those 2 buildings. So all the residents feel it's one community. In addition, this top picture shows the George Waters Nutrition Center is part of one of those. And that serves not only residents, but low income and any seniors across the city. So now we're coming to the main event, Kimball Highland. So I'm going to orient you with this map if you can see the cursor. This big, beautiful green area is Kimball Park. The city hall is just over here. Down here is the beautiful city library. The 2 towers we just looked at are these 2 rectangles. And there's a current city senior center right over here on the corner. We looked at a program that fit with the mayor's discussion of AARP that would create new affordable homes for all age groups. So all the way from, young folks to families to perhaps empty nesters and seniors, but that was walkable because along the right side is Highland Avenue, which is a major commercial center, which has transit that connects to the trolley that we just talked about a minute ago. Also has a lot of commercial. For example, there's Walmart is right here at the top of your slide. The 99-cent store is here. And there's also a Boys and Girls Club. So that's kind of an area we're going to talk about. And this map is going to be a little clearer. Again, the green was the 2 senior towers we just saw. The orange is the site of what we are talking about with Kimball Highland. So the genesis of this is we approached the owner of the 99-cent store site. They had some underutilized parking area that we felt would make a lot of good sense for affordable apartments serving essential workers. We all know who that is now. And we teamed with San Ysidro Health, thinking that, well, let's combine health and housing right next to each other. So we came to the city and they liked that idea, but they said, but wait, we have another site right over here, which has a senior center. Senior center is really aging and it needs to be really changed and updated, expanded, and it's an underutilized site. What about if you had this land too? Could you do something that is on both of those sites? And that's where we became a 2-site project with 145 planned affordable apartments. We call it family, but it's all ages. Providing a new 8,000 square foot senior center that's integrated into the apartment community. We've already purchased all of this yellow, rather orange and red area. We own it today. And the city will ground lease us this other parcel when we're ready to move forward. This is a rendering. It's not quite that bright green, so it looks brighter than it is, but this is apartment, which would be on the corner. The senior center is actually integrated in this building. You don't see from this. But we've also, I'm going to go back here one second. We also wanted to make sure that seniors living here and all through here had an easy and safe way to get to the shopping on Highland and the transit, and if it's Walmart or whatever. So we especially thought about that and created a pedestrian walkway along here so that they can easily go there as well as for the health center. Let me see. So estimated construction site would be summer of this coming year. This is just I'm sure Anna, who is up next, is going to show a much more recent rendering of the health center. But, you know, what we're thinking of, or what is planned for the health area is 40,000 square feet. That's big. 20,000 of a federally qualified health clinic, and 20,000 square feet of PACE, which you'll explain that serves seniors. So it's both seniors and all age groups here. And when it's completed, this health facility will create 250 new healthcare jobs right here in the city center. So that also plays on those 8 areas. And I'm going to stop share and turn it over to Anna, who's going to tell you more about health.
Thank you so much, Mary Jane and Mayor, for your wonderful prelude to what we're doing. First and foremost, let me get us situated here. I actually lost access to the chat, so I'm going to be hoping that someone can help us with the chat function. But before we even go to questions, I want to be able to start by discussing who we are as a health system. And I really enjoyed listening to Mary Jane's explanation of Community Housing Works. And I love the fact that we have a champion in affordable housing here in San Diego. And we're very fortunate for that. And Mayor Alejandra Sotelo-Solis, your ability to provide policy looking through the housing and healthcare lens has just been so innovative and so inspiring for so many of us that it's really a lot of fun to work with the City of National City and coming up with great ideas to benefit our shared families. So before we go any further, I want to introduce you to someone very important and special to San Ysidro Health, and that's our living founding mother, Carmen Martinez. 52 years ago, Senora Martinez, along with 6 other mothers, without any education and without any form of connections or network or grant writing, any of that, mobilized and together organized and were able to make their way to different partners, including the County Medical Society and UCSD, and pleaded for healthcare services to be brought into San Ysidro. The only doctor serving the area 52 years ago was moving to Chula Vista. You can say nowadays that's not a difference, but in fact, it still is a difference. We find a lot of barriers to access healthcare, and transportation is one of them. And through her efforts and that of the other mothers, we were able to start in a very small white home, casita, with volunteer-driven doctors and nurses. And 52 years later, we continue to work on her shoulders and that of our other mothers to improve the health and well-being of the communities we serve with Access for All, or as we like to trivialize, but definitely hold to heart, exceptional care without exception. So a little bit about our patient families and profile. We are able to provide care to 108,000 lives. We generate over close to 500,000 visits annually throughout our 49 program sites. Many of them are throughout the South County, Southeastern San Diego, rural East County, and also North County. 94% of our patients live at or below the 200% of the federal poverty level. 40% are children from birth to 17 years of age. 24% are seniors, 55 years and older, and rapidly growing. We're able to help our families with medical, dental, behavioral health, and specialty care such as acupuncture, rheumatology, and chiropractic. But part of healthcare with San Ysidro Health is more than that visit. It's also support and patient experience. So we're able to provide essential services such as case management, patient navigators, and advocates, nutritional support. We have WIC centers throughout our service areas, health education, such as our partnership with Olive Gardens in National City for cooking classes for children, and family support programs, something as basic as parenting classes and anger management classes, which may seem small, but makes such a big impact. So many of our parents, when they enter the class, they say, oh, I thought I was gonna be able to fix my children at the end of this class, but in reality, the person who needed the fixing was me and not my children. So it's great to be able to reach and get that transformative experience. And then one big need that I'll be developing and discussing more and more that we're responding to is respite and caregiver resources. One of the key programs that we'll be housing in our new facility is our San Diego program for all-inclusive care for the elderly. So with that, every visit starts with what's going on at home. We know that because so much is, when this presentation was being developed, it said positive health outcomes. Well, it's more than just taking a pill, right? It's environmental, it's structural, it's so much, it's policy. So we know that. So when a patient comes in and they're not feeling well, they may think it's a stomach ache when in fact it could be anxiety, it can be stress, it can be depression. So our dedicated providers of care, doctors, nurses, they're all trained, especially with trauma-informed care, to work with our shared families. I want to give you a quick snapshot of the reality when we discuss the service areas that we all operate in, and we'll talk about National City. This is what it was like, and this is just a snapshot. September 15th of 2020, really at the height of COVID. And National City, like many of our service areas here, was experiencing infection rates 4 to 5 times greater than the rest of the county. If you look at the deaths, so much of the deaths were overrepresented by the people, our shared constituents living in this area. And it was a big wake-up call for several reasons, not just as a healthcare epidemic, but also an economic epidemic. What we realized was that many of the families were living in overcrowded multi-generational households. So if we were able to help and meet the need with the mayor's assistance in providing no-cost COVID testing and vaccinations, we're really excited about what we're going to be able to do come in 2023 with our brand new state-of-the-art 40,000 square foot facility. But I think I want to start off in explaining this facility by highlighting what's to the right of it. And that's actually the affordable housing that Mary Jane just went over. What I love and what's key about this picture, if anything, is this, the fact that they're, I want to say 8 feet apart from each other. And that means the world to our shared families. In this building here, you're going to find a lot of multi-generational households that are already experiencing a lot of stress just to live in this beautiful building. You're finding probably years of trauma, probably a lot of overworked parents and children, probably children struggling. Maybe they encountered, like many of our children, a family member who passed away from COVID, which is very true. Maybe they saw a lot of being a year or two out of school really impacted their social network and how they're able to thrive and continue their development. There's still a lot that needs to be researched as we recover from COVID, but just know that these two entities here working together will help intervene and help with that. In more detail, we're really excited because on the ground floor is where our San Diego program for all-inclusive care for the elderly will be located. So if you can just envision our shuttle coming in and dropping off our seniors that don't live in this beautiful building, but maybe they live across the street, or maybe just 5 minutes away, or maybe 20 minutes away still in National City, they'll be able to be brought from their home very carefully and into our day center, also PACE program, to meet all their healthcare, dental, behavioral health, social, therapeutic needs, giving their caregiver some respite time to take care of themselves, or time to work, as many women especially have left the workforce to take care of their loved ones. And then on the second floor, excuse me, my mouse is a little bit more sensitive than what I thought. On the second floor here will be our community health center, which we're really, really excited to provide because it'll allow us to consolidate the 3 smaller clinics that we have in National City and provide even more expanded medical and dental care, but also add a whole new behavioral health department. As we know, especially with our homeless or unsheltered issue and concern, many of that is tied to behavioral health needs. And so we're excited to be able to be a part of the solution and provide that and much needed care to everyone. If you One of the key trends that we also have identified a long time ago and continues to be really a need countywide. I just read an article yesterday that says by 2030, there's going to be 1 million San Diegans 65 years and older. And I wish I could say that we all age very healthy and with grace, but the reality is the older we get, the more healthcare needs we have. So in the next 10 years, per the county forecast, National City is going to experience a 36% growth of seniors 50 years and older versus 17% growth county-wide. So think about that. There's going to be a really, really high need for senior services, from healthcare to housing to transportation in National City. And to augment that need, what we know is that seniors living in poverty in National City is at a rate of 17% versus 9% countywide. In fact, seniors in National City were particularly likely to live in households with below poverty incomes. And think about that. You know, Mary Jane earlier talked about the essential workforce. We were working with our doctors that were saying throughout the pandemic that many of their patients never stopped working. They never stopped cleaning homes. They never stopped driving trucks. They never stopped working in the grocery stores, because they had to feed their families, or at least try to help to feed their families, as many still face men's food insecurity, which is also a social determinant of health. So it's important that we as a community, as a county, come together to help National City weather what's in store. And that's why we really are thankful to be able to be part of this innovative project. So we've had some experience doing this and bringing San Diego PACE to senior housing through our San Ysidro Village, which is just across the street here in San Ysidro from the Southwestern College campus. And in that village, we were able to provide housing to actually several of their tenants were actually unsheltered seniors living in the community. In fact, one of the social workers that helped enroll one of them would go outside and help our patient complete the paperwork to be able to get in. And it's been a very beautiful process to see how healthy they are once they have that security of shelter and of food. And because of COVID, it was very difficult to bring our participants back on site to receive the care that they do because of COVID infection control protocols. So instead, we turned it around and we went and visited them. We had in-home support services. We were able to work with our team and still do birthday celebrations, even if it meant, outside of their homes. We were able to provide welcome packages. We were able to make them feel as a part of a community. And when you talk about, especially people who are unsheltered, you find that the biggest need is a sense of connectivity with others. And so we're looking forward to that connectivity that will also yield positive health outcomes by co-locating both this beautiful housing unit next to a healthcare facility. And we like to say it's more than a building, it's actually building lives. So to go back to what San Diego PACE is, not many people, especially people that are hard to reach, know of this wonderful service in the community. So I'm here to say that it's not just in National City. We're very thankful and happy to be able to provide it there soon enough. But right now we do have PACE centers throughout the county, and it's a wonderful dedicated team that goes and picks up our seniors and helps them age safely at home. These are seniors that could easily qualify to be in a nursing home. But as we know, many of our families would never allow a loved one to go into a nursing home. I can tell you from personal experience, my mother-in-law had dementia and Alzheimer's, and she was very medically fragile, but it would never even enter the family's mind to have nursing care available for her. So what happened is, was very typical of what happens in any family, which is her eldest daughter gave up working to take care of her full time, as her other sisters would come in and provide care as well to give their sister a break. But it really did take a toll on my sister-in-law. She actually became very tired, very depressed, very sick herself, because it was just a very heavy responsibility to carry. And so the beauty of this PACE program is that our family caregivers don't have to sacrifice their own health to take care of their loved one. we can help them with that. And so to qualify for PACE, you have to be 55 years of age or older, live in a covered zip code, and we have over 90 zip codes. About the entire county is definitely eligible for care in any of our facilities. We're certified, the participant has to be certified by the state of California, needing a level of care equal to nursing home services, and able to live safe and independently in the community with the help of our services. At any time, a participant can disenroll from PACE, and their services are covered through Medi-Cal and Medicare. So it's no cost to the family if they qualify. So we did have to pivot some during COVID. Instead of providing the care in person, we were able to do it through telehealth. We were also able to deploy care coaches to go to the homes or the units where they live. During that time, we were able to continue to do wound care, help our caregivers out, meal delivery, grocery bags. We did their shopping. We took their medications. We still provided physical occupational therapy in the homes and counseling. And everyone learned how to be comfortable with virtual delivery care services as well. So with that, we're just so excited, but I can't emphasize enough how co-locating housing to healthcare really does allow a better relationship with the care team. What we have found, we even created a position of a director of housing partnerships where we actually become an integrated team of care for our patients. We work very closely with the housing manager. We're able to even schedule visits from our social workers, our marriage and family therapists, our case managers, our certified nursing assistants to go in to those housing units with trust, knowing that everyone's there to serve the same client to the best of their ability so that we can prevent early deaths and we can focus on a high quality of life with dignity, especially in our senior years. So with that, I'll stop sharing.
Thank you. I really loved the question, what's going on at home? Because I think that just, that encapsulates that. What's going on at home if you don't have a home or you have multiple families living together and there's no peace at home, and the effect it can have on health and even civic engagement. Having a stable home helps your health, promotes people to have more to give to their community.
Yeah, I was going to ask you, Mary Jane and Mayor, you know, many of, for instance, during COVID, the idea to maintain a healthy home was if someone felt some symptoms coming on to isolate in a room. But what we found were many of our families, there's 2 to 3 families living in an apartment because the cost of housing is so expensive in California. And so many of them ended up unintentionally getting each other sick. And when they found out that it was spreading in the homes, they felt horrible and they felt as if there was nothing they could really do. And we would educate them with vouchers and so forth, but it was really difficult for mothers with children. There's no way they were going to leave their children. And so I think one of the biggest lessons learned from this pandemic is just being very prepared for people who live in very crowded housing to see what we can do health-wise from a public health angle to help control and prevent any further illnesses. So I would be interested to hearing your all's thoughts about that, especially during a pandemic like the one we're recovering from as we speak.
Yeah, I would just add that, I mean, you raise a really critical point. When there are multiple families and or multiple breadwinners in one household, the job and potential isolation and or that separation from the family, especially when we're such tight-knit communities. I mean, there is no nursing home for grandma. It is the eldest daughter or the, you know, sobrina or whoever that is. There is not, it's very difficult to say, oh, there is a voucher. We have the hotel space for you to isolate. And it's also the pandemic provided, again, a spotlight on the things that were already kind of disparities within our community, knowing who the healthcare provider was. Do they have a primary care doctor? How does that work? And then, oh yeah, the county government is going to give you a free voucher. Wait, what am I going to have to give up? What kidney am I going to have to donate? Who am I going to have to pay back? Like, there was a lot more questions as opposed to it just being about the housing element. And that's why programs like this can really provide that intersectionality. So within your home, you're going to find out about all of these services, from housing and affordability to the services that San Isidro is going to be able to provide, to caregiving resources that the elders can also have. And they're right next door to Kimball Park, the economic development with Highland Avenue, so many elements that, you know, it shouldn't just be about one thing and only during emergencies. We should be building up those relationships and that infrastructure now. That's why, you know, we've been talking about this, you know, since 2019. So the pandemic was, you know, a little slowdown, but look, we were talking about this, and that's why I'm so very proud about this partnership, because we saw it even before the pandemic happened. But you know, now we'll move to shoveling ground and, you know, get to where we need to get. Right, Jane?
You know, when I was a kid, neighborhoods were just a combination of age groups and to some extent different incomes. They were walkable, and we kind of lost that. What we were the vision we had here was to take what's already there in the spirit and the infrastructure and add, so you have a neighborhood that's thriving, that has, you know, walkability, has you know, access to resources and transit, etc. So when, you know, sometimes I say age friendly and they say, oh, it's for seniors. No, age friendly is for all of us. It's for, you know, little kids and strollers, but it's also, you know, as people do age and they can stay in their community for that support. Which, yeah, I think that's important at every age. You know, the other thing is the health effects of, when we talk about affordable housing, I think my point was affordable housing, an affordable apartment won't have 2 and 3 families lumped in there. It will be affordable, and one family will live there and have that peace of mind. But it's also important that people be able to live in the same communities that they work. And the health effect of that is, of course, on them and on their kids at school, but it's also on all of us, because they're not contributing to driving, you know, from Murrieta every day. And so it's freeing up, you know, the traffic and congestion and air quality. So all of these things work together.
Oh my gosh, Mary Jane, you're reading my mind, because I was going to say it also helps to lower our carbon footprint. You know, helping our climate action plans, which all cities and the state of California is really leading the nation on this, and how we really combat climate change. And if we can get people out of their cars and into mass transit and in a space where they can walk or roll to their jobs. And again, it's, if you have housing that is affordable for the existing community, and I just want to emphasize for the community that's watching online, revitalization is extremely important. It's also just as important, if not more so, that there be revitalization without gentrification. So existing communities that live and have endured housing that has been inefficient, substandard with the mold or the cucarachas or whatever, that we work to make sure that they come up to par, but that the new housing even provides state-of-the-art, LEED certified, energy efficient, age friendly. So you have the handles that any ability can open, and light that, you know, you're in and you're out, right? But I think that's why we have to be very laser focused. Yes, we are going to want housing, but we need to be focused too on not pushing out the community that has endured so much, the caregivers that have been there for their elders. We want them to live here in perpetuity if that's what they choose to do.
And food security is part of health, as we all know. And I know that the city just opened the new park at Paradise Creek on the west side. That has an organic garden to provide space for the neighbors, the neighborhood to come in. When we renovated the two senior towers, we added some raised accessible garden spaces, again, for people. And, again, the nutrition center there for the seniors is another source. But, we all know all these things kind of, walkability, being able to walk, being able to socialize, to see. Zoom is wonderful, but isn't it better when we see people in person and to be able to see people in our neighborhoods and walk there? And then when we need preventative help or when we need some real health services, then they're there too. So that's kind of that's a concept of what we're trying to do as a we're called a cross sector in this partnership.
I think also just the green space, the fact that this is located near a park is just when you connect with nature, it does wonders for your overall also mental well-being. And one of the things that we really promote as a health system is preventative care. And so what we want to do before, if you become pre-diabetic, for us, you're one of our biggest priorities because we don't want you to become diabetic. We want you to change and consider changing your lifestyle for different reasons. But we don't necessarily lecture or, what we do is we are able to refer to classes that make parks accessible, providing maps, being able to prescribe, go to the park and walk around and tell me how many laps you did today, and encourage, small steps, big outcomes, long-term outcomes. And I think what really excites me is the infrastructure in place already. And I think there's a lot of that in our communities, but it's a matter of just, like the mayor was saying, reinvesting and being able to allow them to beautify and to be able to be there for the people who have been so resilient living through this, so that they can, take care of themselves, their family, but live long and live healthy and live happy. Being able to encourage the walking, being able to encourage from eating from the community gardens, being able to incorporate low-cost fruits and vegetables so that people don't have to rely on insulin or injections to live longer, but instead are happier because they're able to control their health and be able to also impact others and influence others as well.
And I think that, I'm sorry, Mayor, go ahead.
I was just going to say, I'm looking at the participants and it looks like there are some people from throughout, municipalities and even the county of San Diego. And, to encourage just this cross-sector participation, we know that there are nonprofit partners and housing entities and healthcare partners that are looking to provide their specialty and partner with municipalities. And it really takes that, hey, remember we were talking about, and for us, it was the age-friendly communities. Community HousingWorks, as Mary Jane shared, actually built our Paradise Creek housing facility. So we knew, and then they did the senior housing. So we knew and had projects to show that, and that were demonstrated to us that they were here for a longer term, and not just the one project, thank you, we're out type scenario, but really invested in our community. Same thing with San Isidro Health. You saw that they have 3 clinics, 3 sites here, including a dental clinic. I think that it's making sure that we have the capacity to highlight what each industry's strength is and how we can each play off of each other. That also too includes leveraging resources. I see Angelita's here as part of the group. So I want to give out to shout out to Angelita and Carlos from our housing. department, because it takes that creativity and that the ganas to be able to find money. And San Isidro hustling to find resources at the federal level to bring the PACE Center, and Community Housing Works to find resources at both the federal and state level. So it's not just like, hey, let's do it. It's really each one of us playing off of our strengths, making sure that we have the idea, yes, to build this affordable housing, intergenerational, state-of-the-art, with a PACE Center and a walking path to and from both sides of the building, and making sure we have the money to do it and the political will. And that's why I'm just very, very proud, of our council for being 5-0 on this type of effort, and knowing that, my colleagues see the importance of this effort, and that it's not just, it's just another housing element. No, this is going, and this can actually be a model for other spaces and how, you can create and strengthen the partnerships. So I wanted to make that case for those folks that are watching. I see, Bridget from San Diego Habitat for Humanity, and the City of Oceanside is on as well. But again, just wanted to make sure that folks knew that, we can definitely offer any pointers or, share our secrets, because they're not, we want people to succeed and thrive, because when you succeed, we succeed.
Mayor, can you talk a little bit about the recent accolade you received from the Robert Woods Johnson Foundation and the prize for the healthcare prize that you were highlighted for?
So the city of National City was one of 10 communities recognized nationwide by the Robert Wood Johnson Foundation for the Culture of Health Heroes Award, which means that we as a municipality, in partnership with Olivewood Gardens and Environmental Health Coalition, and basically all of the nonprofits that have helped really foster this culture of health, we were recognized for the organizing of people coming to council and sharing the importance of removing polluters from the west side of National City. We were recognized for bringing about the first park in 50 years to the west side of National City. The housing complex there, Paradise Creek, that Community Housing Works brought on, the partnerships that we had during the pandemic to bring about the COVID-19 T3, testing, treatment, and tracing efforts for our community with San Isidro and a multitude of, entities. And so to have received this award and to be recognized nationally really solidifies, one, that we're as National City, we're getting that recognition for decades of work, but it also, too, for me as somebody who's third generation, who has seen these relationships grow, the relationships and the strengthening of those conversations is always essential to us becoming a stronger municipality. We write and are rewriting our narrative of what it means to be a National City resident. We are now talking about how working class communities not only deserve state-of-the-art elements, but will advocate in many different ways to make sure that those become reality. So the recognition, it was amazing. We just got the award last week, and it's just truly been an honor to be in this capacity to help advocate, but also knowing side by side, I'm not doing this alone. And, it's gonna be, we've set the bar high, and that's what I like to do. And, this project is gonna be amazing when we see shovel and ground, fingers crossed, 2022.
No, absolutely. I've seen National City just don't accept no, or don't accept obstacles.
Oh, there's that too.
This is not the first big national award that they've received. That's just, they were a recipient years ago of the only award on the West Coast for Sustainable Communities. It was a EPA, Department of Transportation, and that was really for the work of the West Side and saying, no, we're going to make some changes. And so, you know, all the way from their attitude to the fleet of their own cars, of having hybrid cars, probably plugins too, I probably missed, but you know, it's health is comprehensive. Housing is the base. Health is comprehensive. Anna said, we build future.
Lives.
We build
Yeah.
lives, and
Not-
it's Community Housing Works is actually says we build future. So it's so funny. It's the same thing though, of that forward looking and building a future, no matter your age or your current circumstances, you know, it just to improve, to be all that you can be. And that's a cliche, I realize, but it's very important, and it makes a difference for all of us. It makes a difference in community engagement. And then we have communities that are, you know, diverse and equitable, and make a difference for the next generation. I think we have just a few minutes, but Mayor and Anna, if you had other.
I was just gonna say, it's just so important, the work that is being done for so many reasons, but even just from a civic engagement angle, you know, when you're able to register to vote and have a permanent home and be able to feel like you're part of something bigger, it's just so empowering. And so it's so important that we continue to replicate this success everywhere, because it really does, you know, what one good deed begets another good deed, and it just goes on and on. And I'm just very excited to be able to continue to intersect and be able to provide, you know, more of this education and more of this just empowerment and inspiration really for everyone, so that they realize that the sky really is the limit with our families, and make them just provide them the dignity that they've worked so hard, but has been unattainable because of just costs. And so I'm very excited to see this come to fruition.
Agreed. And I have to say that if you see on this panel, it's a little bit of girl power here too. I think there's, you know, the ganas, and how we as women have seen again the desire of wanting to see our communities, you know, thrive, and generations see it a little bit better and a little bit brighter. So I want to again thank my fellow panelists, Anna and Mary Jane, and their organizations for all that they do for our community. And for all of those watching, thank you. We appreciate you, and wish you a very safe and blessed Thanksgiving week. If you can, get your booster, because you know we're getting our 2-minute warning, but this is the PSA. You can come down to National City. We have the juvenile youth vaccinations as at before and after schools at each of the varying 10 school sites. And on Monday, the 22nd, we will be providing booster shots for adults at our turkey giveaway. And if you are from National City, you show your ID, we will give you a free turkey. So
That's wonderful. Everyone should also get their flu shot.
oh, and they will be offering flu shots too. Yes, yes, yes. So, you know, we want you to be safe. We want you to enjoy your Thanksgiving and the holidays safely. So on behalf of National City, come on down, but be safe during this Thanksgiving week. Thank you, ladies, Anna and Mary Jane. You guys are amazing.
Thank you. Thank you for the
both so
panelists.
much.
Thank you for this opportunity, and good evening to all. Thanks.
Bye-bye.